kind of want to go back for a second about the ADCs, because I think we think about them almost interchangeably, right? Like you have the targeting mechanism, which is the antibody, you've got the payload on the other side, which is the chemo. But the part, I used to be very dismissive about is the linker, right? And it's fascinating to me because in the middle you have this linker, but it is how the linker is cleaved in order to liberate the drug. But sometimes the linker stays with the drug and sometimes the linker stays with the antibody. And apparently where the linker is cleaved makes a big difference. So really when you look at Sacituzumab, govitecan, which you brought up, there it's interesting that the linker cleaves on both sides. So you have the free drug, the SN38, and you have the free antibody, and the drug is cleared almost immediately. Interestingly, with T-DXd, you have, for example, this phenomena of bystander killing, right? Like this retention in the tumor's microenvironment is longer, and that drug is cleaved at the DXd to the antibody side, right? And that turns out that that molecule now, which is really a linker plus the payload together floating around, reconjugates with albumin and gets kind of persists for longer in circulation within the tumor microenvironment. So there's some really important distinctions in the mechanism. So all of this is to say is we've seen some positive data now with other TROP-DXd molecules, right? Like we're seeing maybe this possibility that even when you have the same payload, you might get a different result. Maybe you can tell us a little bit about TROP2 targeting with the other payloads.
Right. So looking at other agents like Dato-DXd, for example, we have many trials that are ongoing right now. That's another TROP2 directed ADC. And so we're excited about these results. Certainly the data that's been presented thus far has shown some good responses, particularly in those that have not received a prior TROP2 directed ADC. It's my impression that those patients tend to be responding, at least there's a signal that they might be responding a little bit better. They might be having a little bit more durable responses. And so I think that that's an agent that we're looking at. I know we have trials open right now looking at Dato-DXd in combination with other, for example, immunotherapies in the triple negative space, looking at patients that have significant residual disease after neoadjuvant chemoimmunotherapy, and patients might receive Dato-DXd in combination with immunotherapy compared to the Dato-DXd alone, compared to standard of care therapy as decided upon by the investigator. So I think that that's a strategy, looking at combining the ADCs with immunotherapy. That's something that's very appealing, particularly in the triple negative space where those cancers tend to have higher responses, at least thus far, to immunotherapy. Is Dato-DXd the agent that you're most excited about as far as other ADCs?
I am actually excited about it in the sense that this concept of the payload linker being together maybe gives a certain flavor or characteristic to the drug that might make it more effective. So with DXd being a very different chemotherapeutic concept, right? It's not just the payload. I think it has different characteristics. So I'm excited to see how these drugs play out when the payload is modified in a way where it has these different characteristics.
I think I appreciate what you're saying, that it's not just as simple as the three components of the antibody-drug conjugates, as you said, the target, the payload, and the linker, but it's even more beyond that as far as where the linker is cleaved, and does that linker stay with the payload or does it separate, and how does that impact the pharmacokinetics of the agent, the particular efficacy of that agent. And I think that this is a topic that, after talking to you about it today, I want to read a lot more about.